Hello everyone, how are you? My name is Peter Lokana Kame Simon, student from the fourth year, Bachelor of Physiotherapy. Now, for Rubric 2, in which I was given the topics which is says physiotherapy after pneumectomy. So before I go far, let me first describe what is pneumectomy. So pneumectomy, when we talk about pneumectomy, we talk of removal of one side of the lung, on which whereby the form of surgery which can be performed can be in different ways. If you are like to remove one side, maybe right side lung, which you are, might be like only the most part that can be performed, let me say, is anterior thoracotomy, which can be removed over one side of the, which you can make apply like in the side anterior, which you can be like dividing. So before I go far, like after the topic says physiotherapy after pneumectomy. So after pneumectomy, there are three things in which we need to do during there are very many things in which we can manage pneumectomy, like after surgery. So the one thing is we need to apply the goals. What are the goals which can be applied for pneumectomy? One, we must apply like to improve oxygenation with the oxygenation with the single lung. Like one thing is one lung is removed, one thing we need to improve the oxygen. You know the oxygen supply demand from the system. Then another to prevent post-operative complication. Post-operative complication like atelectasis. One is pneumonia. Another one's like ETC, which can be like maybe mediastrum form. Then the other one is to enhance the chest expansion. Two, to improve the exercise tolerance. These are the goals of how I physiotherapy need to implement. Then in early, now we are going into management. In management, we have early phases. In early phases, which can be applied like for the patient who's suffering from who's like after pneumectomy, after applying pneumectomy. One thing is positioning of a patient. So there are two things whereby there are one things which you can make position for the patient. One semi-pillow position, in which patient can be in a supine position, whereby the legs are, let me say, hip and the legs, hip, knee are straight and the hip is flexed. Then the back is supported, and then the back zoom. Two, in the positionings, there are different ways to position, like in sitting or standing, can be given for a patient. Then second thing is breathing exercise. In breathing exercise, we can give like a deep breathing exercise, semi-segmental like exercise, and instead is spirometry. Instead of spirometry, whereby we give a patient to give out to use spirometer, or you can give a whistle, not a whistle, but you can give also like a spirometer. You take the patient to take a deep breath. Well, let me say like to breathe in the air, or to squeeze the air, to suck in the air using spirometer, or to suck out, to know how the spirometer. Then another one is the airways clearance. In airways clearance, it depends according to the Hafali on how we can present air clearance. Like so, in airways clearance, we can avoid the excessive force. You can also have excessive force which cannot affect the patients. Then secondly, we have one thing is circulatory. In circulatory, like we have ankle pump, which is most important for the patients who are suffering from let me say who has them say pneumectomy. It's also most important. Then another one is we have early immobilizations of the patients. In early immobilization, like sitting on the edges and standing, this can be also one of the important. Then this it was in the early stage. In early stage, starting from 0 to 3 days, which can be applied. Now let us come back to the to intermediate phase. Intermediate is starting from the age of between say 4 to 7 days. In 7 days, whereby we increase the distance of walking, whereby if the patients have been like working for, he has never worked, but we can give increasing the limb. Then begin the mild upper limb exercises. The mild upper limb exercises like flexion, extension of the shoulders, which can reduce the patient's stiffness. Then secondly, postural corrections. Postural correction is very important because why? After applying the after patient's surgery has been applied, why? Sometimes patient force might change because one side of the limb is affected. One side of the limb is affected. Why? Because one side of limb is affected, which can be more important. Then another one is the third phase, which is a late phase. It is the late phase after 1 week. So if it was taken like after 1 week and above, one tip you are keep like exercise training, let me say exercise training, gradual aerobic exercise training, walking, stretching, and a low intensive endurance exercise. We have one breathing training. Breathing is like past lift training. This one can be great training to improve the past lift muscles, like let me say pharyngeal muscles, which can improve the muscles. The third one is this continuous incentive spirometry. This is the most important also. We also educate the patient to increase the most time. Then posture mobility. The shoulder range of motion should be improved, and the stiffness. Then we have some complications. What are the complications which we can get from the pneumonectomy? Pneumonectomy, whereby we have atelectasis, then we have respiratory distress, and the mediastinal shift can be shifted. Thank you very much. We shall thank you very much for attending my lecture. You're welcome.